Course 5, Module 3, Public Health.
When we look at the outlook for careers, healthcare careers in research and public health, they're very much related, and oftentimes they will actually have, they will share degrees. When we talk about medical scientists, those that are doing actual medical and clinical research at the doctoral or professional degree level, like a master's degree, you can see a very healthy career salary. These come from the Bureau of Labor Statistics, and you can see that the job outlook until 2030 is that in this area it is expected to grow faster than the average career. When we talk about epidemiologists, these might be public health scientists, they might be CDC, medical researchers. Again, you have a very healthy salary, $75,000 per year, and 5% growth expected over by 2030, 2029, with a faster than average growth as compared to the average career. So these are good, solid careers, and I would venture to say that anything that has to do with healthcare, public health, is solid for the duration of humanity in terms of career potential.
Review this slide to learn some quick facts about environmental scientists and health educators. I'm going to explain a little bit about each profession. Environmental scientists or specialists use their knowledge of natural sciences to protect the environment and human health. They analyze environmental problems and develop solutions to those problems. Many environmental scientists or specialists work to reclaim the lands and waters that have been contaminated by pollution. They also assess risks that new construction projects pose to the environment and make recommendations on how to minimize that environmental impact. State and local governments have regulations to ensure that there is clean air to breathe, safe food to eat, and water to drink, and that there are no hazardous materials in soils. Environmental scientists see that these rules are in place and followed for the protection of all human beings, animals, and the environment. And environmental scientists or specialists collect and compile data from air, soil, water, and food for scientific analysis. They also advise policymakers and work with industry to reduce waste. They develop plans to prevent, control, or fix environmental problems. They provide information and guidance to government officials, business, and the general public on possible environmental hazards and health risks. Environmental scientists can work in several types of settings, which could be public health departments or other governmental agencies, nonprofit organizations or agencies, or private companies, or even private laboratories. Health educators or health education specialists are folks that work with people and communities with and about behaviors that promote wellness. Health educators often work one-on-one with patients and their families to talk about diseases and about that patient's diagnosis and treatment options. They also develop strategies to improve the well-being of individuals and communities. They create programs to train medical staff to be able to interact more effectively with patients. Some health education specialists collaborate with other workers. They do so such as on statewide or local committees. They create public policies on health and wellness topics. They also develop public health campaigns on topics, for example, such as emergency preparedness, immunizations, or proper nutrition. They work to educate policymakers about ways to improve public health. They have public health in the best interest of all. There are quite a few settings a health educator or health education specialist can work in. Those are healthcare facilities, nonprofit organizations, and public health departments.
And now we'll move into Module 3, Public Health. And again, I've said that there is a strong link between public health and research, because the public health environment is actually the application of all the research that is done on health outcomes, on social determinants of health, on clinical research, and so forth. Public health is the science of protecting and improving the health of people and their communities. The work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and the detection, prevention, and response to infectious diseases like what we're going through right now with the pandemic. Overall, public health is concerned with protecting the health of entire populations. These populations can be as small as a school or neighborhood, or as big as an entire country, as in the case of our current pandemic. The Centers for Disease Control and Prevention is the nation's leading public health agency. It is dedicated to saving lives and protecting the health of Americans. The CDC keeps America secure by controlling disease outbreak, making sure that food and water are safe, helping people avoid leading causes of early death such as heart disease, cancer, stroke, and diabetes, and it also works globally to reduce threats to the nation's health. And you can see that through conversations with regard to polio, with regard to various flus like COVID, where countries begin to help each other. And it's not just to help the other country and their citizens, but also to prevent the spread of those diseases in ours. Okay, in the state of Wisconsin, we have the Wisconsin Department of Health Services Division of Public Health. And this Division of Public Health brings initiatives down from the CDC and other federal agencies and brings them to the state level and into the county level as well. And at times there's, in some states, there'll be city level initiatives as well. There is an A to Z alphabetical directory of all things public health, and I have provided you with the link for that. The major initiatives that the state of Wisconsin is currently working on would include the health of mothers and children, oral health, environmental health, clean water, services for dementia, people experiencing dementia, vaccinations or immunization programs, women, infant, and children programs, tobacco prevention programs, opioid response, disease prevention and surveillance, which would be chickenpox, measles, flu, and others, physical activity and nutrition, health emergency preparedness, services and supports for older adults, flood recovery, and vital records. So these are major programs, not all programs. All right, when we talk about Outlook, we've covered a little bit in the research area, but literally all positions, including administrative, will be covered in the specific occupational levels that we have already covered or will cover. including social work, nursing, psychology, case management, financial marketing, public relations, administrative, accounting, everything. So again, the many areas that you study that you may not think are appropriate for healthcare definitely are appropriate for healthcare. So overall, healthcare has a bright outlook for anyone's career advancement.